This morning, a 75-year-old Singaporean woman and a 64-year-old Indonesian man. Both had underlying conditions and died due to complications. Now, this comes nearly 2 months after the first case of the virus was reported here on January the 23rd. Sherilyn reports.
Singapore's first COVID-19 related death was that of a 75-year-old Singaporean woman known as Case 90. She was linked to the Life Church and Mission Singapore cluster. The woman, who had a history of chronic heart disease and hypertension, reported the onset of symptoms on February 9th. She was admitted on February 23rd to the National Centre for Infectious Diseases, or NCID, for pneumonia, where she tested positive for COVID-19 on the same day. She later developed serious complications and died on Saturday at about 7:50 a.m. after 26 days in intensive care. The second patient, known as Case 212, was a 64-year-old Indonesian man with a history of heart disease. He reported symptoms on March 9th and had been hospitalized in Indonesia for pneumonia. He arrived in Singapore on March 13th to seek treatment at Mount Elizabeth Hospital and was transferred to NCID in critical condition on the same day. He was only confirmed to have COVID-19 the day after. He developed serious complications and died on Saturday at 10:15 a.m. after spending 9 days in the ICU. He was a contact of Case 289, a 62-year-old Singapore man. Health Minister Jung expressed his condolences to the patients' families and urges Singaporeans to not give in to fears.
Our thoughts are with their families and their loved ones during this difficult moment. I've asked NCID to render all assistance that is necessary to the family members. While we all know that there will be fatalities in COVID-19 patients, we are deeply saddened by their passing. I know Singaporeans will be worried and anxious. We must take courage and not give in to our fears. We have announced a series of safe distancing measures, and we must all take the necessary precautions to keep ourselves and our families safe. We must stay united, work together, support one another, look out for each other. This way, by staying together, we will be able to prevail and overcome COVID-19 infection.
Life Church and Mission says its congregants are grieving the loss of one of their church members, the 75-year-old woman who is the first COVID-19 fatality in Singapore. The church is a cluster with 10 linked cases. Lily Ying reports.
The 75-year-old woman battled the COVID-19 virus for nearly a month at this hospital. Now she is likely to have contracted the virus at a church service at Life Church and Missions in January. An infected couple from Wuhan visited the church then. In a statement placed online, the church said the well-being of the family of the woman is currently its utmost concern and urged members to pray earnestly for them. The church added that while the woman's family will be making the final decision on funeral details, the church will be collecting bereavement tokens on their behalf. The woman lived at Bishan Street 12. An MP of the area, Chung Ki-hyong, told CNA that his grassroots leaders had reached out to her family and left their contact details. They will do their best to assist the family during their time of need. Funeral directors CNA spoke to said they have not been approached to handle any deaths of COVID-19 patients yet. But authorities had already set out guidelines on what to do in February. For example, only those who had undergone infection control training can handle the bodies.
The body must be double bagged, no embalming, no washing of the body, and also the coffin must be sealed. Funeral directors or undertakers that will be handling the body must be in full PPE suit to protect themselves. All of us, we are equipped with the skill and the ability to handle infectious disease cases. So for us, we deal with HIV, we deal with SARS, H1N1.
Mr. Teal added that the company will abide by social distancing guidelines to ensure the safety of mourners.
Indonesian Foreign Minister Retno Marsudi has expressed her condolences for the 64-year-old Indonesian COVID-19 patient who died here this morning. CNA understands that the patient was Indonesian businessman Kuncharo Wijaya. Mr. Wijaya was a member of the Jakarta Green Gardens Lions Club, a humanitarian club that runs projects serving local communities in Indonesia. Mr. Wijaya was also known as a successful businessman with extensive trade relations internationally, including China. Now, CNA asked the Indonesian embassy if the body of Mr. Wijaya will be repatriated to Indonesia, and was told that authorities of both countries are still discussing arrangements for the man's funeral with his family. So the embassy cannot confirm if the body will be sent home. It also says it will continue to coordinate with Singapore's health ministry to monitor the progress of other Indonesian citizens being treated in Singapore for COVID-19 infection. Health Minister Jung expresses his condolences and assures Indonesia that the Singapore government will continue to provide the necessary assistance. Parkway Pantai, the group that Mount Elizabeth Hospital comes under, says under a new directive from the Health Ministry, all non-resident patients need to defer appointments or seek medical care elsewhere. Parkway Pantai says it is working with its doctors to ensure these patients continue to be adequately cared for. It says when Singapore first announced DOSCON Orange, there was still a small number of patients who came to the group for critical or essential treatment, as they were unable to defer their care or find alternative medical options in their home country. Mount Elizabeth Hospital was where the 64-year-old